If you or someone around you has noticed they have this persistent cough that has lasted less than 8 weeks and you're worried, you may need to further your consultations for a proper diagnosis on what is making you cough. Dr. Bruce Kirenga, a respiratory physician and pulmonology medicine expert at the Mulago Lung Institute, explains that many of the people who may be experiencing a cough could be dealing with cough-inducing irritants.
To be say what we call pathological, that means it's due to disease, but could be as a reaction to protect your airway. So people need to note, when am I coughing? Why do I cough? Then when you come to the chemical receptors, is where I want to bring out one other group of cough that we need to address. The chemical receptors can respond to anything. It could be heat, but it could be the chemical irritants. Here is where you bring in people who do jobs which involve exposure of their airways to irritants. This could be dust, you could be doing a cleaning job, and those things, they go into your airway and cause an irritation, and you will cough.
Dr. Kirenga says the severity of cough can be determined by how long one has suffered before it is categorized as acute, very acute, or chronic.
Anywhere between 0 to 3 weeks is still acute. Somewhere 3 to 5 is subacute, and anything that goes beyond 8 weeks, we consider it chronic and persistent. Now, acute coughs could be due to viral infection, respiratory infections. It could be due to reactions to the environment. Maybe you are exposed to any irritants in the air or chemical. But also, some of these coughs, especially chronic cough, could be due to identifiable clinical conditions.
However, to elaborate what could be bothering many people out there, Dr. Kirenga says there are common conditions like asthma which are prevalent among unsuspecting patients.
Cause of unexplained cough that we are seeing, and that's actually what maybe you want us to speak about, is what we call post-infectious chronic cough, PICH. This condition is very common. You get an infection, the infection clears, and now you get into a persistent cough. The commonest infections are respiratory viruses, and that's where the COVID-19 will come in. The infection itself, the virus, will be cleared by the body. But because the infection caused inflammation in the lungs, you find that that inflammation continues to irritate the lungs, and you continue to cough. This kind of cough, it actually does not need antibiotics, and that's also what we are seeing. You'll find that you have picked all the tablets or the syrups, especially for children, and the cough is not going away. Because the infection has gone away, it is the after effects of the infections which are affecting the person now. The best treatment for this kind of cough is to reduce this inflammation.
He, however, cautions that there are some other causing agents, including air pollution, which lead to coughs and that one needs to take seriously.
If you have a cough, even if it is one day and you are coughing blood, if you have a cough, even if it's one day and you have chest pain, and you are breathless, and you have a high fever, okay? And you collapse, then this cough is already serious enough.
Kampala normally records poor air quality due to exhaust fumes contamination, especially during morning and evening times when many motorists are entering or leaving the city. Ivan Baguma, a qualified nutritionist and dietitian, explains how you can strengthen your immunity.
When they get used up a lot, you need to replenish them using local foods. The local foods available, the first one will be the fruits. Because vitamins like C, which are high in fruits like lemons, any citrus fruits we have locally available. You can try some pineapples, are really good, especially for reducing inflammation. The pineapple stem especially. It's really good. Some people even make natural remedies using the pineapple stem. You can use plenty of fruits and vegetables.
Globally, cough is a common ailment that affects 1 of every 10 people chronically, but may not necessarily be infectious. Mwesigye, NTV.